Hey guys, today I'm going to be talking about the top 5 mistakes people do after total knee replacement surgery.
The information contained in this video is intended to be used for educational purposes only and in no way represents medical treatment or advice for your specific condition. Any injury sustained while performing these exercises is solely the responsibility of the individual performing these exercises. Equitable physical therapy and starters disclaim any and all liability for injuries sustained from performing the exercises mentioned in this video. As always, it is best to consult personally with your medical health provider for personal treatment to address your specific needs.
I'm Dr. Wong with Next Level Physiotherapy, and this channel is dedicated to helping people like you get out of pain naturally without relying on medications, injections, or unnecessary surgery. The first mistake I see people make after total knee replacement surgery is not having a plan. There's a saying that if you fail to plan, then you're planning to fail. After total knee replacement surgery, you might need to rely on your friends or your family to get you around to your doctor's visits. Something to also think about is, are you going to a facility or back to your house for a short period of time? Now, who's going to get food for you? Who's going to do laundry? And more importantly, what does your medical team look like? For those of you going home, you want to make some accommodations like getting rid of your throw rugs so you don't potentially trip over them. You also want some night lights if you have to use a restroom in the middle of the morning so you can see a little better. And also, if you have 2-story house, you want to have a bed on the first floor to make resting easier throughout the course of a day. The second mistake I see people do after knee replacement surgery is not taking enough pain medications to manage the pain. This operation is a major surgery and you're going to have some pain, swelling, and tenderness around the new joint. I know many of you are scared of getting addicted to narcotics or opioids that your doctor might have recommended after surgery. Just know that you can always contact your surgeon to change the medications that give you the negative side effects. I've never been the one to tell my patients to take pain medications, but after knee replacement surgery, if you don't manage the pain, it becomes a lot harder to tolerate physiotherapy. With more pain, you'll probably move less and the surgical knee will become more stiff. As the knee becomes more stiff, it gets harder to move and improve your range of motion. This is how the vicious cycle happens. You want to prevent it from happening in the first place, so you're able to maximize your progress when you're going for physiotherapy. The third mistake that people do after total knee replacement surgery is just not listening to their body or doing too much too soon. So this includes progressing to a cane from a walker without consulting their physiotherapist or their surgeon, or participating in high-risk activities like hiking or jumping within the first month after total knee replacement surgery. You definitely want to challenge your knee under the supervision of your physiotherapist, but not to the point where you have severe knee pain or if the knee feels unstable. You also want to avoid falls and allow the tissue around the knee to heal as much as possible. Just to give you an example, I have patients who have both knees done and the supposed bad knee recovered faster than the better knee. So it's just hard to say what your recovery process looks like until you go through with the surgery. The fourth biggest mistake that people do after total knee replacement surgery is stop therapy too soon or forgo physiotherapy altogether. As time passes, the knee pain will decrease on its own. However, if you forgo physiotherapy after knee replacement surgery, you won't maximize the strength, range of motion, and function of the knee. Most programs will last 8 to 12 weeks to get you back to doing all the things that you gave up on prior to having the surgery. The fifth mistake that people do after total knee replacement is compare themselves to other people. Knee replacement is a major surgery and there are many factors that affect your recovery process. So everybody's different going into surgery, so it's not fair to compare your process to a guy next to you who had the same knee done. If you have any questions, please comment below and my team will get back with you as soon as possible. Also, if you found these videos helpful, please consider subscribing so you don't miss out on our weekly videos. As always, move better, age stronger, and I'll see you on the other side.